Joining DMU in 2019 to study medical science, Becca McDonald was inspired by the commitment of healthcare workers, including her own mother, who were grappling with the early uncertainty of the COVID-19 pandemic. Longing to be on the front lines and helping patients in need, she decided to switch courses and enrol in adult nursing. After the switch, Becca never looked back and thrived. Through a mix of full-time placements, theoretical and practical teaching sessions in our state-of-the-art facilities, Becca was able to master all of the core skills nurses need in such a high-pressure and demanding environment. Having returned to campus to continue her studies, Becca was able to see how healthcare systems in Dubai operated through the incredibly popular DMU Global initiative. Due to the variety of opportunities her course and DMU Global afforded her, Becca secured a job as a nurse in a prison before officially graduating from DMU in January 2024. I'm delighted to say that Becca is back on campus to discuss her time at DMU. Welcome, Becca.
Hi. Hello.
Hi. I'd like to take you back to spring 2020. And COVID is, of course, having this huge impact on the country. Do you remember exactly when you made the switch to adult nursing, and what was it that prompted you to do that?
So I just remember that with the whole pandemic, we were told to, sort of stay at home and go home. So I went back to my parents, and my mum being a nurse, and obviously I'm surrounded by mum's friends, which are nurses as well, seeing sort of everything on the TV and all in the media about all the nurses and the healthcare professionals and the work they were doing during the pandemic. I remember just sitting and going, no, this is what I want to do. I want to be able to help people and to actually go out and look after people, as opposed to being in a lab, which was more what I was doing with medical science. So although I can't remember exactly when it was, I remember just sitting there and being like, going to my mum, like, this is what I want to do. Now, this is what I'm going to do.
And it was quite, I suppose, at that time, it was quite a scary time, because now we all know how the pandemic panned out. But at the time, we didn't know what was going to happen. So I guess that's quite a bold decision to make, that you're kind of like, I want to be on the front line. Was that you just felt really driven from the examples of your mum and your mum's friends?
Yeah, exactly. Like, it was terrifying to sort of hear the stories and see people going out into those environments and hearing them come home and saying about how tough their shifts had been. But it did sort of, like you said, drive me to want to do it more and to want to be one of those people that can go out there and look after people and help people in, the worst sort of time of need.
Wow. So you decide to make the switch to adult nursing. Was it a seamless transition?
It was so easy, really. Okay. I remember just contacting the uni and saying, long shot, but I'd quite like to do nursing. Is there any chance that I could transfer onto your nursing degree? And I had an email back from the admissions team sort of within 24 hours saying, yeah, like, we'll give you an interview. And if you, pass the interview, then yeah, sure, we'd love to offer you a transfer. I remember I was on holiday with my family at the time. I did my Teams interview, and within 2 hours, I had a phone call from them saying, we'd love to accept you onto the nursing degree. And I was like, oh, amazing.
Obviously, when you then join the nursing degree, and I imagine it must have been a very different experience for students who joined nursing during COVID to people who'd maybe done nursing before or since. So what was that experience like? Did you feel supported? Did you feel, were you thrown in at the deep end? How did that feel?
So for my first year, it was majority online teaching because of the pandemic. We had a few practical sessions on campus that were necessary to do in person and be assessed on. But overall, it was majority Teams teaching. So it was difficult because you weren't seeing your peers, you weren't seeing your lecturers, but our personal tutors were amazing. Like, we used to have regular Teams video calls with my personal tutor. She'd ring round, she'd make sure everybody was okay, make sure everybody's family was okay. And it felt so supported whilst we were at home. You felt that even though I hadn't met her face to face, you felt so supported, and I knew exactly who she was. And then I remember seeing her on campus for the first time and being like, oh, we've had so many, telephone calls, but it's nice to actually be able to see you in person.
Yeah. And I suppose that it was such a peculiar time for so many people, but that remoteness for such a practical course must have been quite challenging.
It was difficult. Like, we were doing some skills that you thought, this would be much easier if I was able to like do it in person and
Yeah.
ask those questions. But the lecturers were really good in making sure that they adapted those sessions to work online as much as they could. And, you know, now looking back at it, I think, well, I've got the skills that I needed to do it. So something obviously worked.
Yeah, exactly. Absolutely. So once then you get back onto campus after COVID and you're able to come back on and use some of the facilities, do you feel that really helped your practical skills, the sort of facilities that we've got here at DMU?
Oh, 100%, because you can talk about the theory behind, you know, taking bloods and things like that over and over again. But until you actually practice doing that, you know, you don't know really what it's like to do it. So to be able to go into like the simulation rooms and to actually practice on the mannequins and, you know, even when it came to things like using stethoscopes, being able to practice on each other, it helps you to actually take that theory and put it into practice. So you actually do know what you're doing. So definitely beneficial.
One of the things I was really keen to ask you when I knew I was meeting you today is that first time, that first placement that you got sent into a hospital, I presume, what that felt like when you go from practicing these skills in a safe environment with your other students on the course and your tutors and maybe a plastic dummy or practicing with a stethoscope on another student to actually being in that live environment with real patients. What does that feel like?
So my first placement, it was during the first year of teaching. So at this point, I'd barely been on campus. Okay. So we were all absolutely terrified, you know, to like go into the hospitals and be like, I've not actually, you know, seen the person really to practice. Yeah. But again, the uni was so supportive. They understood the situation we were in, that we hadn't had chance to fully practice in the simulation labs and things like that. The practice like supervisors on your placement, so the nurses that look after the students, they were fully equipped to make sure that we were given that support to practice things. And it did feel a little bit like being thrown in at the deep end to begin with, but it was that incredible feeling because it was still during the pandemic to be able to actually do what I said I wanted to do, which was I'm going to help people. Whilst all this is going on, I'm going to go out there and help people. So although it was difficult at times, it was really, you know, well supported and I learned a lot of skills on there.
Yeah. You're so driven. Like I've been talking to you for about 5 minutes, but you're so driven in that kind of want to help people. And so even being in that quite terrifying environment where you don't know what you're doing and, you know, you're meeting your first patient for the first time, is it that drive to help that really gets you through the nerves?
I think it is, especially when, like, I remember thinking to myself, well, I'm nervous to be here, but these patients are here having treatment and they've not got family members with them. They can't have relatives with them. So I was like, these patients are poorly, you know, they're obviously feeling probably much more nervous than I am about this whole situation of what's going on. And I think that did help me to sort of go, okay, I just need to do this, need to help them, do what I've set out to do. And it definitely helped push through with those nerves.
That's amazing. That's given me goosebumps. In terms of your training then, what were some of the standout moments for you?
So being able to like go on the placements and the variety of placements that I did, that's obviously been such a highlight because I've seen so many areas of nursing that probably wouldn't have actually considered had I not gone into placements there. Because there's so many different avenues in nursing that to be able to have a selection of these was incredible. And then also like the layout of how the teaching worked with being able to have theory sessions and then actually take those theory sessions into practical settings and do the practice and actually learn those skills. It was, you know, it really helps you to build those skills and to go, okay, I know what I'm doing. And like the further through you got and the more skills that I got, I was there thinking, I'm going to be a nurse. I've actually like learnt these skills to be a nurse. And it's a really nice feeling when you've had that support to be able to practice it and go, yeah, okay, I can do this.
Yeah. You said there were some other interesting placements that you did. Where else did you go? Where else did nurses practice?
So one of my probably standout placements was when I did my community nursing. So my mum works in the community. And I remember when I got my placement to say that I was going into the community, I rang my mum crying because I went, you love your job. Like you tell me how much you love your job. And I can't understand, like I don't see the appeal in that aspect. And I went out there and it was probably one of my favourite placements that I'd done. So something that I'd never really seen the appeal of, I was then able to actually go and do it and think, oh, amazing. So yeah, as well as being in the hospital, I was able to go into a private hospital and do some of my training in a private hospital. I had the community placement. I did a placement in the prison, which obviously I've then gone to work in. So I was able to get such a variety of placements.
Yeah, and really see where nursing can have an impact. Yeah, amazing. Who's your biggest inspiration?
So I do think my mum has to be. I think, working in healthcare and growing up seeing my mum working in healthcare definitely has been like a huge inspiration. But then more recently, like I said previously, being able to like see in the media the hard work that the healthcare professionals were doing, that's definitely been something that has inspired me on more of a, a general level as opposed to a personal level. But yeah, no, definitely my mum has to be.
Is she proud of you?
Oh, definitely. Like she tells me a lot that she's proud of me.
Oh, that's lovely.
Yeah, and I remember like graduation day, like her and my dad, and they were like, "Oh, we're so proud of you." And it's nice. It's nice to have that, especially come from somebody who's done it, who works in healthcare
and kind of knows what you're doing. Yeah. So I mentioned earlier that you jetted off to sunny Dubai whilst you were studying at DMU to learn about healthcare systems overseas. And I think you've said previously to the university that it had a huge impact on you, that trip. Can you tell me a bit about it? Like what happened?
So it was incredible. It's, something that I'm never going to forget, going to Dubai with DMU. It was amazing because we got to stay on the DMU campus over in Dubai. So it was really nice to see their campus university over there. But also we had a lovely mix of like lectures. We had small sort of more seminar sessions where we discuss sort of health inequalities in a country in a city where you look at it that is very affluent, and actually being able to go over there and see if that's actually the case in terms of health and things like that. So we got to go and see a hospital over there, a kidney hospital. So that was so interesting to be able to go over and chat to staff over there and just to see what it's like for healthcare in another country, and to actually compare that to sort of what we've got over here. And it just like, the pros and cons of sort of abroad and UK nursing. It was so interesting to be able to have those conversations with staff and discuss that on sort of a level with the university and peers and things.
Did you come back, I suppose, with an appreciation for the system in the UK, or kind of like, oh, there's things we can learn and we can do differently?
100% both. It's you really, when you see it and you see the private aspect of it, you think, wow, the healthcare system we've got over here, we are so lucky to have that. We're really privileged to be able to have that system. But then you also looked at aspects of it over in another country and you said, if we could adopt something like that, I think it could help to improve our system. So you have the appreciation, but you also see how other areas are doing things that could necessarily benefit us if we adopted that.
Yeah. And then what about just the experience of being in Dubai? How was that? You've been before? Everyone says, I think it's like 45 degrees there at the moment.
I'd never been before, but it was very warm. But the experiences we got to have were incredible. Like I'd seen on TV programs, like the lights and everything so fancy, and it was amazing to actually go and see that. We went on a little fountain show boat trip, me and some of my friends, and it was beautiful. We went into the desert and we went on like camel rides, and we went
did the whole thing.
So so when we got the time off, it was amazing. We went around this beautiful like botanical garden, and just to see all those different sites across both Dubai and Abu Dhabi was amazing.
Yeah,
very warm.
Very hot. And you definitely strike me as someone who makes the most of opportunities when they come along. Obviously, at DMU Global, something that's open to all students, but not all students obviously take advantage of it. But you've obviously seen that and gone, wow, I want to do that, and change courses and gone, I want to do that. You're obviously quite a sort of focused person who knows what they want. So what are there any other opportunities you think you took advantage of or benefited from whilst you were studying for your degree?
So one of the key things that I think I did that was beneficial to sort of me in terms of skills and confidence and things like that is I joined the student ambassador scheme when I was at university. Yep. So I helped with open days and showing prospective students around. And I really enjoyed doing that because I really like talking about like my job and what I do and things like that. So it was really nice to talk to prospective students about DMU and Leicester and nursing, and actually be able to sort of say, oh, I really enjoy doing this and here's why. So that's probably one of the key things I did. And then I've been able to sort of stay and do that with the uni as alumni following through. So it's been a good opportunity that I'm really glad I've taken.
Obviously, you trained as a nurse during COVID. You had all of those experiences, and then you leave with your degree and your very proud parents, and then you go into quite a different role. So can you talk us through that?
So whilst I was studying and whilst I was doing my training, it was something that I'm not really sure where it stemmed from, but I thought, oh, I quite like the idea of going into prison nursing. And I discussed it with the uni. I said, is this something that you offer placements for? Because it's not really something I want to go into blind. I'd like to see if it is something I'd enjoy. And the university went, oh, we can look at it for you. They then set me up to go on a placement there. I loved it. I really enjoyed it. It's obviously quite niche, but there was just something about the environment and the banter and things that you have with like the staff in there that I really enjoyed. And the management there said, you like it here, don't you? I said, I do. They went, do you want a job? I was like, oh, yes, definitely. So, definitely a bit of a niche topic that I'm not really sure why I initially decided to go down that route. I'm very glad I did because I absolutely love it. Really, really.
So what does a typical day as a prison nurse look like for you?
So there's different roles depending on what you're allocated for the day, but like one of the roles is the triage nurse. So you'll have a list of patients. It might be going doing bandaging or giving out medications, or going seeing people with diabetes, or people that have complained that they're feeling generally unwell, and you'll go and see them. You'll try and find out what's going on. If they need a referral to the doctor, you'll sort that. If they need to go to hospital, you'll organise that. And then one of the other roles is you're in the reception. So every single person that enters or leaves the establishment, whether that's for court, for hospital, for release, for transfer, or they're new in, everybody gets seen by a nurse. So just to check the physical and mental health, they're okay, any concerns they can mention to us. So I enjoy doing that because you get to see everyone that comes in or out and have a chat with them. And, you're sort of, especially the new receptions that come in, you really get to sort of like build that rapport with them. And, you're their first point of contact. So they can come in sort of feeling quite in a bad way, and then you can sit down and have a chat with them. And again, it goes back to that. I feel like I'm making a difference and I feel like I'm helping. So there's different roles, and each day is different because you might get your emergencies and you're on emergency response, and that can be like working in A&E, where everything's very quick, very fast paced, but each day is different. And I think that's one of the reasons that I like the job so much.
So you're currently working as a prison nurse. Is that where you see your career staying, or where do you want to take your career over the long time you got to go, given you graduated in January 24? So
at the moment, the prison's where I see myself. Like I said, I really enjoy it. The actual role, the staff that I work with, sort of both healthcare and the officers, it's such a nice sort of staffing team that I enjoy going to work, which I know not a lot of people can actually say that they look forward to going to work.
Yeah.
So at the moment, I see that, sort of that is where I want to stay.
Yeah.
There's also chances for progression to sort of work my way up to sort of hopefully like be able to sort of prescribe medication and sort of work my way up sort of management level through that. But then for me, I know that I'm much more community based than hospital based. So I think any job that I did go into in the future would be more sort of in the community or working through prisons as opposed to going into a hospital as such.
Yeah, brilliant. Would you do it all again?
Yeah, I would. It's like, don't get me wrong, it was difficult. It's not an easy course to do, but the friends I've made, the opportunities I've had, the skills and sort of the memories that I've now got, it's 100% is something that I'd recommend to anyone, and I would do again, definitely.
Our Vice-Chancellor often says that actually you can tell whether a university is doing its job properly by its alumni. And I have to say, it's been an absolute pleasure talking to you today. I think you're a total inspiration, and you've really blown me away with your commitment and just that drive to want to do something and then follow it through. So I hope that the university was able to support you on that start of that journey, and I can't wait to see where you go next.